Okay, so I'd like to start thanking Oftech for the kind invitation to share our experience with Artisan and Artiflex lenses. So for high degrees of myopia, hyperopia, we have to go inside the eye to correct this refractive error. So we usually use Artisan and Artiflex for over 9 diopters of myopia and 5 of hyperopia. Of course, there are some cases like this with a low myopia, moderate myopia of -5, that the cornea does not allow refractive surgery on the cornea. So then we have to choose go inside the eye. This is a flat cornea of this patient. So there are sometimes we need to correct with an intraocular lens. One main advantage, if we are not using a toric lens, that's a possibility, but if you don't want, you can adjust this surgery later on doing a corneal procedure, so a surgery, adjustable surgery, we call bioptics. I don't like the posterior chamber lens because of the incidence of cataract, as you can see here, related up to 55% of patients when this lens sits over the crystalline lens. So there are lots of published papers, and this is a meta-analysis with more than 6,000 eyes showing that iris fixated lens, or meaning Artisan and Artiflex, has only 1% of cataract development. So it's a very low incidence compared to the posterior chamber lens. So this is one reason I prefer Artisan and Artiflex. Another reason is that it's a very well-known lens for more than almost 40 years. Of course, it started for aphakia, and then they started producing for phakic eyes. And we started implanting Artisan lens back in '99, so it's been 18 years of experience with this lens, and I love it because the results are very, very good and with a very low instance of complications. In 25, we had European approval for the flexible, for the foldable model, the Artiflex, and then we started doing Artiflex in Brazil too. So we have mainly these 3 models. The foldable one, the first one, it's Artiflex for myopia up to 14.5. We have also the the 6mm optical zone of Artiflex for these myopias too. And for high myopias, higher than 15, and for hyperopes, we have this, the bottom one, it's the PMMA non-foldable Artisan IOL. So the advantages are, it's an iris fixated IOL lens, so it stays far away from crystalline lens, far away from the corneal endothelium, far away from the angle. So all the complications of angle supported lenses or posterior chamber located lenses we don't have in this lens. So it's a very, very safe lens to stay inside the eye, and we have experience all over the world for almost 40 years, and in Brazil for 18 years. So it's a great lens, so that's why I chose this lens, and I keep using them. And you don't need any limbal white-to-white measurement, so one size fits all. It's reversible, of course. If you need to perform a cataract surgery or any other surgery, you can remove it. So, and its predictability is very, very high. So it's a great lens. So here you can see through the OCT image. It's very safe for corneal endothelium. So you need, of course, a minimal cell count, but as a normal cell count for each age. And there are many papers, and my experience also is that these lenses don't increase the endothelium loss. When I perform a corneal surgery over it, if I need to correct residual refractive error, I usually wait 3 months to perform corneal surgery, and it's very safe. You can always do also in the same time when you implant an Artisan or Artiflex, you can perform a flap, and then after 3 months you just lift the flap and perform the photoablation. So this is an example of the Artiflex lens. It's very easy to implant. It goes through a 3.2 or 3.5 clear corneal incision. You may not suture it, but I prefer to put one stitch. It's going to be safe. With this forceps, specific forceps, it's very, very easy to implant and to fixate in the iris. So, and you can always use with a corneal graft. This is a PKP, a penetrating graft, because this lens is very safe. So it doesn't increase the normal endothelial corneal loss that we have during our life. So it's pretty safe even for corneal transplant eyes. So we have almost 250 eyes implanted with these lenses, more Artisans of course than Artiflex, because Artiflex is newer. And you can see the results. They are very predictable, both for myopia and hyperopia. And this you can see in our old days when we used this ACS microkeraton to perform LASIK back in the 90s. And it's very safe to perform it with an Artisan in place. And this is a radiokeratotomy patient with an Artisan hyperopic correction that I did. And then I performed a LASIK over it, so it's very safe to perform LASIK after Artisan or Artiflex implant, even with a microkeraton. So most of patients gain lines, of course, because we are correcting inside the eye. Complications occur, of course, but it's a very low instance of complications. We have some patients with iritis, more in the Artiflex group than in the Artisan, but still a low instance of complications. And this complication that is afraid, a dislocation of the IOL, this is mainly due to the surgeon that didn't want to fixate, to grasp too much iris. So in the first case, we are afraid of grasping too much iris, but we need to grasp it in order for this lens to stay. And of course, if the patient has a trauma, it can dislocate, but it's very easy to reposition this IOL. So this is a very good example of grasping this lens inside the eye. So in summary, it's a very easy surgery for the anterior segment surgeon. Patient satisfaction is really high, and with Artiflex, with a small incision, the visual recovery is very fast. 2 or 3 days after surgery, the patient is already very, very happy. And the complication rate is really very low if you choose correctly the patient and if you, of course, perform the surgery in the correct way. So thank you very much. This is a view of our city in Porto Alegre, Brazil. Thank you very much again for your kind invitation.